I'm Dr. Rana. I'm a pediatric optometrist at University Children's Eye Center. What is keratoconus? Well, before we talk about keratoconus, I just want to add what is the normal way the eye works. So we have a clear cornea, which is very smooth and round, and that helps the light make a clear focus on the back of the eye. In a keratoconic eye, what happens is that the cornea starts to thin down and it causes a bulging of the cornea, and that really forms a cone in later stages and causes distortion and blurriness of the vision, and that is usually considered keratoconus. How do I know if my child might have keratoconus? Well, when we test your child for a comprehensive eye exam, we are looking at various things that give us some cues as far as any changing of prescriptions that happen rapidly, where they become more nearsighted very quickly, and or their astigmatism tends to change over time. We also look at the quality of the reflexes when we are measuring for glasses, and they also give us some cues as to the changing of the shape of the cornea. The other thing is when we are looking at the corneal structure under the slit lamp or the microscope, we can see the shape of the cornea and also look for changes in that shape of the cornea that give us more information whether someone is showing early signs of keratoconus. Right now, I don't think there's a very clear etiology behind what causes keratoconus, but we assume that the keratoconus eyes are linked with genetics. So if there are family members who have keratoconus, they can obviously have more keratoconic eyes in the future children. We also look at keratoconus in kids who rub their eyes a lot, and also in children who have allergies or predisposed to it. If left untreated, there is always a likelihood for the keratoconus to get worse over time, where the shape of the cornea continues to deteriorate over time, the thinning of the cornea gets worse over time, and also the blurry vision and distortion of the vision changes and gets worse over time. So yes, the keratoconus can definitely progress over time. Can keratoconus cause permanent vision loss? Yes, again, linked to the other question we talked about, that it happens many times only in patients if they're left untreated. If you're actually doing management and treatment of keratoconus, it really slows down the progression of the keratoconus, and we try to avoid getting to the later stages of keratoconus, especially given our new technologies in today's world. If we do suspect a child having keratoconus, the first thing is to do what we call a corneal topography or a pentacam, which is a machine that looks at the front and back surface of the cornea and takes some measurements for us. Sometimes we use that as a baseline to see if things can change over time, and sometimes that's very diagnostic as well to tell us that the child or the teenager does have keratoconus. Once we do know that someone has it, there are mechanisms to try and slow down keratoconus. The first using cross-linking. Corneal cross-linking is basically strengthening the collagen fibers in the cornea. It is done using riboflavin eye drops and ultraviolet light that actually strengthen the collagen fibers in the cornea. This is usually a technology that is more widespread in younger children right now. If that helps the progression of the keratoconus, many children need is only the corneal cross-linking. Sometimes as the keratoconus progresses, glasses don't help children a lot, and in those cases we fit them with custom-made contact lenses that could be made of an RGP material, a hybrid contact lens, and in some cases a scleral contact lens that is specifically made for the keratoconic eyes is also done. Can my child play sports with keratoconus and have normal activities? In most typical cases, yes, children can have normal life and have normal activities, including sports. There are some cases, especially severe keratoconus cases, where we do recommend only specific kind of sports that we allow them to play. If you notice your child is having frequent prescription changes, or there is anybody in the family who has keratoconus, please call us for further evaluation. Our office number is 732-613-9191, and we hope to see you here.